Hello everyone, welcome to NG's Corner for Nurses. Today in this video we will discuss about the part 1 of the topic of water sealed drainage. In this video we will cover the related anatomy and physiology of lungs, the concept, purposes, indications and the principles of water sealed drainage, then the site of drainage tube insertion and the sizes of chest tubes. Let's start with the related anatomy and physiology. Pleura is a closed serous sac which encloses the lung. It has two layers, that is parietal pleura and visceral pleura. The parietal pleura, which lines the inner surface of the chest wall and thoracic surface of the diaphragm, and the visceral pleura lines the outer surface of the lung and its fissures. The pleural cavity is a potential space between the parietal pleura and visceral pleura. They are separated by a thin film of serous fluid, which is sufficient to prevent friction between them during breathing. The pleural space or pleural cavity forms a closed system, and this layer of liquid transmits the diaphragm movements to the lung, causing to expand and contract. As the lung tissue is elastic, it tries to resist these movements and generates a negative pressure within pleural space, that is -4 to -8 centimeter of H2O. But when the pleural space is invaded by air or fluid or blood, the negative pressure connection between the visceral and parietal layers is lost. The diaphragm can no longer control lung movements and make breathing difficult. To re-establish the normal lung function, it is necessary to re-establish the negative pressure by removing air or fluid or blood from pleural space, and the most common way to do this is to use the water sealed drainage system. Intercostal water sealed drainage system is insertion of tubes into the pleural cavity with attached drainage system so as to remove air or blood or fluid from the pleural cavity using water in a closed bottle acting as a one-way valve permitting the unidirectional flow of air or fluid out of the pleural space. Now comes the question why it is called water sealed. Water seal means that the water in the drainage bottle seals off the atmospheric air, thus prevents the entering of air or fluid back into the pleural space. Next, coming to the purposes of water sealed drainage. The first is to remove air and fluids or blood from the pleural space, to prevent drained air or fluid from re-entering the chest cavity, to re-establish negative pressure into the pleural cavity, to promote re-expansion of lungs, and to provide continuous suction to prevent tension pneumothorax. What is tension pneumothorax? Pneumothorax is an accumulation of air in the pleural space. And what is tension pneumothorax? When a large air accumulation in the pleural space and when air goes inside the pleural cavity but can't come out of it. Hence, there is a air trapping. And this air trapping increases pressure in the chest and reduce the venous return. Let's see the indications for water seal drainage. First is pleural effusion. Pleural effusion is a build-up of excess fluid between the layers of pleura or in the pleural cavity. Next is hemothorax. Hemo means blood. So, it is a condition where there is an accumulation of blood within the pleural cavity. Next is pneumothorax. Pneumo means air. That means the pneumothorax is the accumulation of air in the pleural space. Next, coming to the hemopneumothorax. Hemo and pneumo. That means there is an accumulation of blood and air within the pleural cavity. Next is chylothorax. Chyle in the pleural cavity. It is a rare condition in which lymphatic fluid leaks into the space between the lung and the chest wall. Next is empyema. It is a collection of pus in pleural cavity. And in any case of chest trauma and some of lung and heart surgeries are the indications of chest tube drainage or a water seal drainage. Next, coming to the three principles of water seal drainage. First one is gravity. Gravity enhances the flow from higher level to a lower level. Therefore, always keep the chest drainage apparatus below the level of person's chest or patient's chest. Next, the second one is underwater sealed. This water seal is a barrier to prevent a backflow into the pleural space. Third one is the suction. Suction is a pull force which is needed when gravity is not enough or when patient's respiration is too weak or to speed up the removal from pleural space. Next, coming to the site for inserting the drainage tube. Site of inserting drainage tube often depends upon the content to be drained out. The fourth or fifth intercostal space between the anterior and mid-axillary line is generally used for most situations. The area bordered by the anterior border of latissimus dorsi, the lateral border of the pectoralis major, inferiorly a line to the horizontal level of the nipple and superiorly by the base of the axilla. With these boundaries, it creates a triangle which is known as the safe triangle. And in the presence of an apical pneumothorax, placement of a chest tube in the second intercostal space should be considered. These are the different sizes of chest tubes. Next part of this video will coming soon. If this video is useful for you, then please like, share and subscribe my YouTube channel or follow my Facebook page NG's Corner for Nurses. And for any queries or suggestions, you are most welcome to comment. Thank you for listening.